This conference will now be recorded.
Okay. So thank you everyone for attending our study coordinator town hall for CureGN. Just a couple of housekeeping items. This town hall is being recorded. If you're not speaking, please mute your phone. And the recording will be available on Basecamp. And if you want to ask a question, but you don't want to speak up, you can use the chat function. So we're going to talk about some remote biosample collection, as well as biosample shipping, biosample query resolution, and then some follow-up from the DPR training. So first, for the remote biosample collection, we have Haley from U of M here, and she is going to discuss remote biosample collection with you.
Hey everyone, thanks Melissa. Is my audio okay?
Yes.
All right, great. So hello again everyone, sorry, late in the day. I hope you're doing well. I'm here, like Melissa said, just to talk a little bit about the remote biosample collection that has actually been an option in CureGN for some time. So we're just kind of doing this as a little bit of a reminder and kind of walking folks through how to do this logistically. So the first things first, this is really an opportunity that can support your patients. That is really the rationale and the reasoning behind this is to make it essentially a patient-centered activity that'll make research participation easier for your patients by giving them additional options. It's also the hope and it is the intention that this will actually be able to improve retention, which we know is a big concern in cure. And then it leverages existing relationships that patients may have already with their clinical, like their local clinical lab that they may use that's closer to home. So for a lot of our patients, they have regular monitoring of, for instance, like their TACRO levels or something like that, or safety monitoring for different labs. And so many of our patients who do live further away have a local lab that they consistently go to. And so this just capitalizes on that already existing relationship. I'm just gonna put a gentle reminder, could folks just mute their phones? We're getting a little bit of noise, it's a little distracting. Thank you. Next, you have the opportunity with this to really just some feedback to use your centers, maybe satellite sites. So if you're a larger institution, maybe you have different satellite clinics around your state or a little further away. And so you have the option to use those, or you could actually do this with any agreeing local labs. They do not have to be affiliated with your institution. This is something that is regularly used in cohort studies. And in clinical trials, as well as, and specifically in studies that are sponsored by the NIH in the nephrology space, in addition to other areas. So this is something that's been around for many, many years. What I can say in our experience locally, the program that I run here, we have done this for at least 7 years now. And again, in both cohort studies and clinical trials. And like I said earlier, this is something that has been available in CureGN for many years. It is in the protocol and it's IRB approved. So we're just kind of reminding people that this is an opportunity and walking through kind of how to do this. So you can go to the next slide. So I kind of alluded to this before, but a good opportunity to use this is, again, when your patients are maybe not able or willing to come into CureGN to your site for their yearly in-person visit. This really gives them the option to complete like a virtual or a remote study visit and add on the remote biosample collection as a parallel activity. So you're still capturing specimens and data, but the patient doesn't have to come all the way into the site. So this is a really nice opportunity for patients that live further away or maybe are not clinically being followed by your institution anymore. And then in order for this to happen, the lab must agree to partner with you. Go ahead. So how do we start? How do we set this up? So the first thing you're going to do, again, this is a patient-oriented activity. You're going to ask the participant, hey, hey, are you willing to do this? Would you be willing to get your labs collected closer to home? Is there a local lab that they prefer? So again, if they already have a lab that they work with, we can try to work with them. And then when would they like to go? Ideally, the specimens should be collected Monday to Wednesday for shipping purposes, but we actually have a little bit more leeway than we initially thought. So if you did need to collect them later in the week, that would be okay as well. We're going to be making that update. I'll talk more about that in a little bit. And then, like I said before, you got to contact the lab and they have to agree to partner. You can go to the next slide. So this is kind of the roadmap for how this works, and sort of the big steps that are necessary. So you need to prep the lab. You're going to prep the patient. The lab's going to collect the specimens, and then the site is actually going to receive those specimens. And you will see I kind of kept that roadmap up at the top there so you can follow along the steps if it helps. So this slide is really important. It's probably the most important slide that I have. This is really some key tips for making this interaction successful for you, for the patient, for the external lab. First and foremost, there are two things that you want to do to set the lab up for success. You want to give the lab a call before each collection. Unless you're doing this on a weekly basis with the same lab, you're going to want to call before each collection. And when you call, you right away, you want to ask to speak to that lab supervisor or lab manager. And the reason for this is not to be difficult. It's not for you to sort of be a difficult in person, but labs have a very high turnover rates, and they also have processes that change very frequently. So if you do these two steps, it will help to set the overall, like the remainder of the interaction that you're going to have up for success. They're really, really critical steps for you to have a positive experience, but also for your patient to have a positive experience. Next. So when you call the lab, you're going to confirm they're willing to do these things. Are they willing to draw the research labs if we provide their appropriate materials and compensation? Will they centrifuge an SST tube? Can they ship all the specimens ambient same day for us? And then can they send us an invoice for payment? And then if they agree to all of that, sorry, I'm getting some background noise. Can you hear me okay? Okay, I'm gonna go ahead and just keep going. I apologize. Hopefully you can hear me all right. There is an example script for this conversation that's included in the MOP for remote biosample collection. So you can kind of use that to guide your conversation. When you're talking with the lab, you want to make sure you ask for the shipping address for the delivery of the kit. And then really, really importantly, get the name and phone number of that person that you talk to. Whoever that manager or supervisor is, get their phone number. You're going to actually give it to the patient, at least their name, so that when they arrive, we're sure that everybody kind of agrees, okay, they've confirmed this with our supervisor. This is on the up and up. We can go ahead and do this activity. Next slide. So a little bit more about logistics. You got to prep the lab, like I said. This is kind of part 2 of that. You, the study team, are going to prepare and send the kit to the lab. And the contents that you're going to include are listed here. So you're going to have a lab order, just like you would for any clinical lab. You're going to send the patient, or you're going to send a lab order to the lab so that the patient, or they have the ordering information for that patient. You're also going to send there's this remote lab requisition form that you're going to actually, I have on the next slide, but we'll get to that in a minute. That's going to be completed by the lab staff. It's very simple. You're going to send just the collection tubes, just the specimen collection tubes. You do not need to send the processing tubes. The lab is not really going to process any samples. They're just going to centrifuge one tube. So you just need to send the collection tubes. The instructions for how you process and ship and all of that, there's a cover letter, which is shown here. Again, it just kind of orients the lab and it says, hey, we got the okay from so-and-so to do this. Shipping supplies. So you're going to use a single, like the same ambient box for all of the back and forth of the samples. So you're going to include actually a little, like a sheet in the kit that says, hey, don't discard this box. We're going to need it for the return shipment. And then the shipping air bill, and you should pre-complete the ship to address just for convenience for the lab. Go ahead. Oops, can you go back one? There, nope, other way. There we go. So next you're gonna prep the patient, right? So you can kind of do these activities in parallel, but prep the patient. You're gonna let them know when the lab kit has arrived at the local lab. You're gonna remind them again that they ideally should have the specimens collected Monday to Wednesday. Ask them when they plan to go to the lab, just so you have a sense of when those specimens will be collected and when you can expect to receive them. Then you're gonna wanna follow up and make sure that they successfully completed the collection. You may not find that step necessary, but we do think it helps. And again, it kind of confirms, lets you know that like, hey, these specimens should be coming in the next day or so. You're going to instruct the patient to take, there's a letter here, it's a patient letter for the lab. You're going to ask them to take that with them. It looks very similar to the letter that the lab gets directly, but this again, it kind of closes the communication loop for the patient, so that when they get to the lab, they hand this to the person that checks them in, and it has the name of the person who you talk to, like that lab manager or that lab supervisor. It has their name on it, so that everybody again kind of knows we were given the go ahead to do this. This letter has been submitted or is being submitted to E&I, and it will be approved since it will be given to the patient. And then lastly, you're going to let the patient know that they should not receive a bill for the research collection. And if they do, they need to contact you right away to get it corrected. Next slide. So the next couple of steps are kind of combined, but you know, you've prepped the lab, you've prepped the patient goes to the lab, and the lab is going to collect the specimens. Yay. There is basically a highest priority set of samples that are being collected. So it's a limited collection. It is not the full, you know, typical blood draw type collection that you are doing at your normal care visits. The only thing that you're collecting one EDTA tube, one SST tube, and a fresh urine sample. That's it. So it's the highest priority specimens that are needed. And then the lab's gonna process that SST tube, which really just means they're gonna spin it down in a balanced centrifuge, and then complete the requisition form, which is shown here on the right. Very simple. It just collects the date and the time, the urine volume, and then if for some reason, like one of the blood tubes wasn't collected, it just is indicated there. And then go ahead and the lab will, you know, complete the air bill, and they're gonna ship everything ambient overnight to the site. Once the samples arrive at the site, you guys are just going to process the specimens according to the usual procedures for processing in the MOP. And then you'll label the aliquots with the CureGen labels at that point. Can you go back for just 1 second, Melissa? One thing really quickly that I want to point out is we've been asked this question, you know, what if there's a shipping delay? We all know that there's a lot of shipping delays currently. So what if the specimens can't get to, like, are shipped out from the lab, but they don't get to the site for 2 or 3 days? These specimens, as long as they are kept at room temperature, or I guess, or probably cooler, but I can confirm that, but as long as they're at, you know, not hot, they are okay ambient for up to 7 days. So that's in the that is in the MOP. I didn't get a chance to add it to the slide. I just got this confirmed yesterday. But you have up to a week to process those specimens. Obviously, the sooner the better, but you do have that kind of time, I guess, grace period to be able to process them. Okay, go ahead. So a couple of tips. From doing this in the past, one of the things that we have found to be incredibly helpful has been to orient the conversation with the lab as something that is really for the patient. This is to support the patient, and a lot of times that is a really good way to help kind of smooth the path to make this happen and help the lab kind of increase the likelihood of their partnership. Use the tracking information in your shipments to monitor kit movement. Set up alerts for yourself so you don't have to go in and check it all the time. You can set up alerts through your email. We recommend that you go ahead and actually include a urine collection cup in the kit when it's sent to the lab. My understanding is that in Cure, you guys, you kind of pull your own urine collection cups, you know, when you see the patient and give it to them, and they're not included in the Cure kits. We would recommend, so that it doesn't get missed by the lab, that you actually include a urine collection cup in that kit when you send it to the lab. And then lastly, one of the things that we've just found to be more convenient is you'll see on the different forms in the MOP that there's a lot of places where like you include like the site or the PI's contact information. And one thing that we've found locally is just a time saver is to just create some very simple labels, like, you know, kind of typical labels with this kind of information on it, so that instead of filling it out by hand every single time, you can just really quickly slap a label on it and put it in the kit, and it can go when you're ready to ship to the lab. Next slide. I think that might be all I have. So I'll sort of stop there and ask if there are questions. I haven't seen any in the chat, so if folks have questions, feel free to shout them out or post them in the chat.
Thanks, Haley. That was really a great presentation, and I appreciate you coming and giving us your input.
No problem. If folks have questions, just let me know.
And as Haley said, the MOP Appendix A is the remote biosample collection instructions. It's got the overview of the remote biosample collection, as well as the instructions for collecting and shipping, the remote lab requisition form, the cover letter to the remote lab, the letter for the participants to take to the outside lab. This is not SIR approved yet, but it is in the process. And then an example script for the request of local labs. So when you talk to the lab. And thank you, Haley, for getting all of that put together. Okay. So I haven't seen anything come through on the chat or anyone speak up. So if you guys do end up having any questions about this, please go ahead and send it to the CureGN at project management address, and we will forward those on to Haley and get responses for you. Okay, so I want to talk a little bit about biosample shipping. Let me pull up the link here and get signed in. So the last update that we had in Link, there was a couple of things that were added to the shipping process, and okay, this didn't like my login. Okay, let's try this again. Okay, there we go. So I just want to kind of go over it just to make sure that everybody is on the same page. Okay. So when you go in, just the basics for the collection, when you go into a participant's iTask, and you go to their visit, and you fill out the blood and urine collection form, and you mark it as collected, the sample kit, the date, as well as the barcode. And just make sure you scan it. A lot of times when you hand type it in, you might have an error, especially with all the different zeros that are in there. So you definitely want to try to scan it. And then you populate it. And so these are saying, because this isn't the enrollment visit, that the most recent DNA consent for this participant is not yes. And actually that's not because, so we shouldn't be collecting these if they said no. So this is just kind of like a reminder to you, like, oh, we should not have collected this information, okay? And then once you have, these have already been shipped, so I'm not able to change that, but go to continue, and you go to the next page. Oh, it's not gonna let me go to the next page because that has the error messages on there. Let me find one that doesn't. Oh, good, this one has a yes consent. Oops, I opened the wrong one. Okay, blood and urine collection. Okay, this one's collected. It's got all the information. It's got everything marked as collected or not collected. So then we just go ahead and you send that to shipping. Okay. And let's go to the facilities task. Now there's a couple things I want to show you on here too that was added. You'll notice here we've only got a few of the manifests listed here. Well, one, we need to go ahead and mark complete if we want to see them all, or to see the completed ones as well. Now, if we don't see everything we're looking for, so if I do sort this by date, the most recent one or the earliest one I see is from November of 2021. But if I go up here to the upper right-hand side where it says show archives and I click it to turn them on, and then I go ahead and sort it, and the earliest I see then is from 2/25/20. And that's just because the system has only been up since CureGen 2. So, and the end of CureGen 1. But you'll be able to see all of your manifests going back from the beginning of your participation in CureGen. Okay. So let me go and take away the complete so it's easier to find. So we want to go to NIDDK shipping. Okay. And again, so this one we just show that we have 3 samples that need to be shipped. So we'd go ahead and mark those as shipped. If you have a lot of them and you're shipping everything, you can always use the shipped button to select everything just to make it a little bit easier for you. We want to go to carrier and the tracking number and then the shipment date. So we'll ship it today. Okay. And now you can print out 2 of these pages, or you can wait till the next page. And it's going to show you your total shipment. So right now we show 3 samples. So we'd want to make sure that's all we have in the box. I know when you get to larger shipments, you still want to make sure that what the count that you see here in link is the count of what's in the box. That by making sure that you have the right amount in the box, that'll help alleviate a lot of issues down the line when we're trying to do the reconciliation, okay, with the repository. So that's one of the big things, is just make sure you're shipping the right amount. Okay. So now you can come here to the print, and you can print all pages, and I'll print both of these pages out for you. You can keep one for your records and then throw the other one in the box with the samples. And then you would send it to shipping. That means everything's all locked up, ready to go. And then you want to email the manifest. Now, we email the manifest and we wait for this pop-up to come up. So it's coming up really quickly for me in GNLink or in test. It can take like 45 to 60 seconds to come up. So just be patient, and you just want to click it once, because the more you click it, every time you click it, that's how many manifests you'll get. So I've done that in error where I've clicked it a couple of times thinking like, oh wait, did I really click it? Once you see the green message that says that it went through, then you know you've clicked it, okay? And you just wait patiently for this. So it'll show you who is getting the email and who's CC'd on it, which will be, it'll go to the repository, and then you will be CC'd on it, as well as your PCC lead and myself. And it just shows you like where it's coming from. And then it also shows you the attachment. So you do have the CSV file. That's the format that Precision requires. So it's all included for you. You don't have to worry about doing anything extra for that. Now you can go ahead and edit either any of these except for the attachment one. You don't want to take anyone away, but you can add if you have another coordinator that's maybe not on here or somebody else you wanted to include in it, you can do that. You can also, in the message part, you can add to it, say, so like if you're doing like a manifest for something that's already been shipped and you weren't able to get the manifest out, then you can say these were previously sent or something like that. If you can spell better than I can. Previously sent. So you can just put a little note in there if you want, and then you would hit send, and then with confirmation, you'll get the email. And once you get the email, then you know it went through. But yeah, so once you see this green, you know it's gone through. And then you just wait for the pop-up. Okay. If you need to go back in and do one, so say let's go back into facilities task. And we want to find a completed one. Okay, so let's see, complete. I want to go the other way. There we go. So say I wanted to do yesterday. I could go ahead and just go in here, go to the second page, and just hit email destination facility again. Here comes the pop-up. And then you would just hit send. And that is how you can resend one if you needed to. Okay. Any questions about the biosample shipping? Okay. As you know, if you ever have questions, just let me know. So biosample query resolution. I know I haven't sent one out recently, but there will be one coming soon. So just kind of remind people exactly what you need to do. So if the query says that it's at the repository, but it's not used or shipped in link, then you just need to, one, confirm that the sample should have been collected and shipped. And if it was, then you just want to request that the DCC, that we unlink the sample for you so you can change the status of it. And then you would mark it as used and then ship it. If the query says it's at the repository, just not shipped in link, then you want to go in and mark it as shipped and create a manifest. And then send the manifest on to Precision. And just let them know that the samples were previously shipped, similar to what I did in the example. Okay. And then shipped greater than or more or equal to 60 days ago and not at the repository. All you need to do is just confirm you do not have those samples in your freezer. Okay. And then just let me know. We have had a couple of sites where I've found the samples in their freezer. It doesn't happen very often, but it does happen. So definitely just look to see if they're in there. You don't have to do anything else. We don't want you to go ahead and have us unlink them so you can mark things as not used. Because then if it could just be that it hasn't been accessioned yet at the repository, and then that would just cause you then to have to come back and ask us to unlink them again so you can put them in as used. So don't change anything in link. Just confirm that you don't have them, okay? Because I know sometimes the repository gets a little backed up with their accessioning. So but as long as you know you don't have them, then I can go to them and say, nope, I need you to double check and make sure that you guys have them there. So. Any questions about biosamples? Okay. All right. So some follow-up from the DPR training. So I know that every site is going to be on a different schedule, you know, when your PCC has you get started. Just a couple of reminders that your GN link uploads, you want to upload the pathology report at the enrollment visit. And then that gets uploaded, and then I will do a QC on it to make sure everything's right. And then I'll send it back, or I will notify you if anything needs to be changed. And then once it's past the QC process, I will send it on to the pathologist to review it for enrollment. Okay, so the EM images, you can upload those really pretty much at any time after you've enrolled them. Just make sure when you're completing the CRF that you don't do that until you actually upload the EM images. And then biopsy slides, you want to do that prior to shipping the DPR to the DPR, because we need to make sure that the labels are correct, that you have them on there correctly, they're not hanging over anywhere, and they're not covering any of the specimen, and that it is covering all of the previous labels information. So let me go back into Link. So just want to kind of show you where everything is, because we did separate out the slides and the EM images, okay? So let's go to someone that's active. Okay, so in the enrollment visit is where you want to upload the pathology report, okay? And what you'll notice is when you go in here, up on the top left corner, there's a biopsy ID. This is the ID that you need to be labeling all of their pathology stuff with, okay? The report and the EM images. This is just like another way of de-identifying, okay? So if somebody that came across these that wasn't part of CURE, they wouldn't even be able to identify like what site they're from. So it's just that additional cautionary there. So you want to make sure you label everything with this biopsy ID, okay? And then you upload it. And then if we go back to the ITAC, so that's all you have to do at the enrollment, okay? And then you want to go to the enrolling biopsy material. And this can be done only when you upload, okay? So we have the EM images upload, okay? So again, you see the biopsy ID and it says where EM images obtained. So when you answer this, it actually comes through for me to QC it. So if you answer this before you upload anything, then it looks to me that, okay, you marked it as no images, so you're not able to get those images, okay? So do this only once you know for sure that you're never going to get them or when you actually have them. Okay. And then we have this pathology slide collection, which is where you'll put in the barcodes. Okay. And there's also should be, back through the sentence, let's go. Oh, probably because they're not enrolled yet. You'll also have a pathology slide upload, okay? And that's where you're going to upload. You'll just take a copy of the slides on your copier and then upload that copy to us. And just make sure you put on the copy what the pathology ID is or biopsy ID. Again, so descriptive identifier, this is very important that you guys do take this information off of the pathology report. So initials and names, the patient, the hospital, the lab, physician, pathologist, operators, any name on there, okay? As well as sex and gender. So yeah, you want to take off like it's female or male, but you also want to make sure you get the other ones too, like him, her, he, she, because that identifies their sex as well. So please make sure that you take that off as well. Race, logos, QR code, all of those descriptive identifiers need to come off. And then also the number identifiers such as date of birth. You can leave the age in there, and we want you to leave the age in. So if it's like a 27-year-old, leave that part in, but remove the birth date. Medical record, bed numbers, telephone number, fax, CLIA, all those numbers. Any numbers that could possibly identify, please remove. If you leave on like a ICD-10 code, that's okay. But just as your own reference, any number that's not associated with like a count of how many things are in the image itself. Yeah, just want to make sure that you remove those. An example of this is that you see where it's nicely redacted and things are easy to see. Yeah, if we go over to this one, it's kind of sloppily done and it kind of overwrites some of theirs or blacks out some of the other information. So I just ask that, you try to do it as neatly as you can. I know when you're doing it in different programs, sometimes it's harder to keep your hands steady. I do get that. But just please, if you can, just try to get it as neat as possible so that when the pathologists are actually doing the course scoring, they can see everything that they need to see. Oops. Okay, any questions? Comments? We're happy to answer. Okay. So if you do have any questions or issues after this town hall or at any time, if it's an issue with GN Link, please email the CareGN project management at arborresearch.org and CC CareGN help at arborresearch.org, as well as your lead PCC. And I get included, anything that goes to CareGN help, I get included on those emails. So just make sure that you include any information that could help us, like the study ID, visit, CRF. Screenshots are great. Okay. And if it's a question other than link, then you can just send it to just the CareGN project management email. Our next round of town halls will be in April 2022. So if you have any suggestions or ideas for the call, please email them to us, because we want to make these productive for you. You know, we want to give you information that's going to benefit you. So let us know what you want to hear or see about. Okay. Again, any questions, comments? It doesn't have to just be cover what we went over today. It can cover anything Cure related. You guys are all so quiet today. Well, I really appreciate you taking your time and spending it with us today. We look forward to seeing you in the future. Thanks, everyone. You have a wonderful day.